Hi everybody, I'm Dr. Jordan Williams. Today's 3-minute injury report is about shin splints. What are they, how they happen, and what you can do to help prevent them and fix them. Shin splints. Well, that's kind of a pain in the shin. What do you do about it? Well, there's a few different things that you can do about it, but let's start with the anatomy. If we take a look at the knee and draw it from the side, you can see the shin muscle is actually the muscle that goes in the front and comes up here, and it helps that foot to move up. So your toe comes up when the shin muscle is engaged. When you are pushing off, the calf muscle is the one that engages. If you have questions about that, go to our other videos where we talk about calf strains. So when you have shin splints, a lot of the times it's due to really abnormal footwear that's too worn down to be able to support you, or even hiking uphill for a whole lot of time because you're doing that over and over and over. If you changed your biomechanics while you're running, this can also cause some of that pain. Well, so what can you do about it? Thankfully, there's a couple of great things that you can do in order to help decrease some of the pain in the front of the shin. One of the first things that you would do is stretch the shin. Well, how do you stretch that? Well, it's attached to a bone, it's attached to the ankle, it's attached to around there. It gets kind of a little bit difficult and complicated, but there's a great way to do that. What you can do is put your foot up on a table, onto a shelf, anywhere that's nice and stable, and then just sit back on that. When you sit back on that, you should feel that right on the front of the shin. You can also do that like on all fours where your feet are nice and straight and then you sit back on the heels there. The second thing that you can do is just straight toe raises. So getting that pumping motion back and forth. You're just doing range of motion here, so it shouldn't feel super painful, but sometimes it can be a little bit of a stretch, a little bit of discomfort. So getting that motion back and forth there can really help to decrease some of that irritation as well. The last thing to do, and this is super fantastic, is contact your local physical therapist, i.e. us at Proof Physical Therapy, and purchase a cryosphere, or if you don't want to, use a piece of ice, and do what's called an ice massage on the front part of that shin, where you're just coming back and forth, back and forth. This 2-3 minutes max really helps to make a huge difference in decreasing some of that pain and irritation. If you tried all these things and they've helped, we'd absolutely love to hear about it. So drop us a comment in the box below. If you tried all these things and they're not helping quite as much, absolutely we'd love to be able to help you out. If you're interested in buying a cryosphere, we can also help hook you up with one of those too. And we look forward to hearing from you. Thanks.